Hello, I'm Dr. Maurie Markman from Cancer Treatment Centers of America. I'd like to briefly discuss two abstracts that were presented at the recent 2021 American Society of Clinical Oncology meeting in the gynecologic cancer area. As always, there are many interesting abstracts, new drugs, new combinations, new strategies presented at ASCO. But this year was unique, in my opinion, because there were actually two incredibly important phase 3 randomized trials that did not set a new standard for the management of two different conditions, but rather clearly established an existing standard. The first study, called Outback, looked at the question of the use of adjuvant chemotherapy following chemoradiation therapy in the management of locally advanced cervix cancer. Chemoradiation therapy has now been used for several decades, very well established, improved survival in cervical cancer, but it had been unknown if additional chemotherapy following the chemoradiation might improve outcome. This study clearly demonstrated it does not. Patients were randomized in this international study to chemoradiation and therapy stopped versus chemoradiation plus 4 cycles of carboplatin paclitaxel. The addition of the 4 cycles of carboplatin paclitaxel did not improve PFS or overall survival. Therefore, very clearly, the standard of care now is and should be chemoradiation without adjuvant chemotherapy. Clearly, clinical trials are always of interest, but outside the clinical trial setting, this would be the standard. The second study looked at another very interesting question, this time in ovarian cancer. It has been known for almost a decade that the use of bevacizumab maintenance therapy in the first-line setting significantly improves PFS in advanced ovarian cancer. However, the initial trials that were conducted very appropriately had an endpoint, approximately 15 months of of maintenance chemotherapy with bevacizumab. So the open question was, would giving additional bevacizumab beyond that 15 months maintenance improve outcome? And again, another international study known as BOOST, phase 3 randomized trial, patient randomized to sort of the standard of care of bevacizumab maintenance for 15 months versus 30 months of bevacizumab. The study clearly demonstrated no additional benefit from the use of the additional 15 months of bevacizumab. Therapy was reasonably well tolerated, but no improvement in PFS or overall survival. Therefore, the standard of care, if one is using bevacizumab as a maintenance strategy in the first-line setting following the response to platinum-based chemotherapy, would be 15 months of bevacizumab, not longer. Again, two very important studies, not changing standard of care, but clearly confirming the existing standard of care. Again, clinical trials are always of interest to try to change the paradigm because of improved outcome. But today, these are the standards of care demonstrated in these excellently performed randomized phase 3 trials. I thank you for your attention.